Tony, I know it's difficult to talk about the attack, but we should.
I was painting up in Mohonk. Lots of light. My dad came with me, so I was annoyed. I'd wanted to go solo. But it's good he was there, because when I moved my easel near the tree line, I saw this shape.
Okay. Tell me more about that.
It was daytime. They're nocturnal, right?
Yeah.
It shouldn't have been there. But I saw it, and it just stared at me. And then it started running, right at me. And then I turned and ran, and I'm fast. I used to run track, but I didn't make it 2 feet before.
So, before this most recent attack, you hadn't seen the wolf in over a month, correct? Yeah. Hey, Tony, is the wolf here right now? Okay, all right, here's what we're gonna do. I'm gonna go get your dad, and we are going to talk next steps, okay? Okay. I want to keep him overnight for observation. The delusions are back, full on. I'm so sorry, Hector.
This last attack, he was screaming, clawing at his throat. He thought he was dying. My little boy. How's he supposed to live like this? And what's he gonna do when I'm gone? I've been reading about deep brain stimulation.
Deep brain stimulation is not designed for psychological issues. It's for Parkinson's. It's people with physical ailments.
But there's trials happening right now.
Yes, Hector, a handful of patients with delusional disorders have tried it, but, you know, the side effects are not, we're not talking scars here. The kind, funny, artistic son that you know and love right now, it can change Tony's personality.
Ativan, Paxil, Klonopin, cognitive behavioral therapy, hypnosis, ECT, electricity shooting through my Carino's brain. That hasn't changed him. Because it has.
We can try a compassionate use trial. But, Hector, you gotta know that if you send your son in for this surgery, you may not recognize the person that you get back. Do you understand?
If helping him means losing some of him, parts of him I love, I'll pay the price.
The wheels on the bus go round and round, round and round.
So he really has to be awake for this?
Yeah, it reduces the risk of damaging critical areas that control speech and other skills. You know, you can't have him draw, so singing is the next best thing.
Go round and round, round and round, round and round.
Very good, Tony. Keep going.
Advancing the wire.
The wheels on the bus go round and
Pull back.
round and round. All through.
Let's keep going.
You know, you've raised an amazing young man.
For his 13th birthday, he begged me to take him to the Uffizi. What kind of kid begs to go to the Uffizi?
But I took him, and he marched straight up to the birth of Venus, studied every detail, and he knew what he wanted to be when he grew up. But then the wolf appeared and never left. And all that potential.
I hope the wolf goes away so he can be that man again.
You're not real.
I don't understand.
Well, it's an agricultural co-op.
It's not a hospital.
No, it's not.
What kind of medicine do they practice there?
None. They don't practice medicine there. That's the point.
You're suggesting I send my son away without me to a farm? To a place where they claim the way to fix him is to pretend that he's not sick?
You know, Hector, one of the keys to avoiding relapse in delusional disorders is environment. Plain and simple. And Tony's current environment, it's not helping, you know?
You mean me?
And me. And this hospital.
That boy is the pride of my life.
I know.
He needs his father. Someone who loves him, who'll run through walls for him.
No, listen. You're trying to fix him. We're all trying to fix him. And on a very deep, profound level, Tony feels that. He knows it, and it's making him worse. This place will accept him as he is.
You're telling me to stop trying to make him better? To not be his father?
You told me that to help Tony, you'd be willing to risk losing some of him. This is how you do that.
Ava! Hello.
Hello, Dr. Jeffrey.
How great to see you.
Your trip was all right?
Well, as all right as an 18-hour flight can possibly be.
You already know Dr. Latham. This is Dr. Rhodes, another CT fellow.
Ah, great.
Dr. Jeffrey is not only one of the world's greatest heart surgeons, but was also my mentor in Cape Town. Taught me everything I know.
I have read your book, Dr. Jaffrey. It's an honor to meet you.
Oh, please. I'm just another patient today.
There's a tumor on the upper lobe of Dr. Jaffrey's right lung.
It's invaded his superior vena cava, obstructing blood flow to his head and upper extremities.
We'll need to remove a portion of the lung and resect the tumor.
And I want my star pupil to oversee the procedure.
Thank you for your confidence, Dr. Jeffrey.
Yeah.
We're getting an OR prepped as we speak.
Just one thing. I don't tolerate anesthesia well.
Well, we can talk to the anesthesiologist about adjusting your cocktail.
No. I think I have a better idea. You place a high epidural and load me up with bupivacaine.
Hold on, you would like to be awake for the surgery?
Well, strictly as an observer, of course.
No, it's just that we would be taking an unnecessary risk. The epidural site could hemorrhage from the blood thinners alone. You could be paralyzed.
Not if we do it off pump.
Right. We can construct a temporary graft from the brachiocephalic vein to the right atrium, clamp the superior vena cava, and remove the tumor.
Certainly eliminate the need for a bypass.
Exactly.
Absolutely. We'll do it. That is, of course, if it's okay with Dr. Latham.
Good. I think Dr. Jaffrey has alleviated my concerns. I'll make the arrangements.
Thank you.
I'll let Forspen know about the high epidural.
Did we really just agree to allow a patient to be fully awake while we perform open heart surgery?
Dr. Jaffrey is well aware of the risks and has given us his consent.
There is no way that we can guarantee we'll neutralize all of his pain, and even if we do, every time his lungs inflate, it'll obstruct our field.
I have faith in our anesthesiologists and Dr. Becker.
Awake surgery is extremely risky and should only be performed when medically necessary.
I understand your concern, Dr. Rhodes. But I trust Dr. Jaffrey's judgment and respect his desire to observe. If I were in his situation, I certainly would see my own beating heart.
Some pressure.
Yeah, I can believe that.
My ventricles, contractions still look strong. No fatty deposits. My coronary artery is pristine.
Very healthy heart, Dr. Jaffrey.
You eat a lot of oatmeal, Dr. Jaffrey?
Good one.
I'm ready for the scalpel.
What? Why scalpel?
I need to divide the azygos vein.
But shouldn't you do the entire dissection first? Say that to last.
She's got a good angle on it now.
Yeah, but what happens if something goes wrong? I mean, good Lord, you won't have enough collateral blood flow to bypass the obstruction.
Dr. Jaffrey, I want to remind you that you're awake to observe this operation, not conduct it.
Oh, sorry. Force of habit. Sorry. Please proceed, Dr. Becker. Well, surely you don't intend to use a quartering knife.
I thought it would help to...
It'll help her keep ahead of the bleeding while she cuts.
No. You do not touch me with that torture device. Did I fail to teach you proper surgical technique?
You always said it's important to maintain hemostasis.
Yes, after the cutting and the tying of the vessels individually, not charring them with a bloody cautery knife.
There's a lot of cooks in this kitchen.
Yes, well, my well-being's at stake here.
I understand, Dr. Jaffrey. I'm fine. Give me the meds. There. I've got everything. I'm ready to reconstruct the vena cava. Give me a 20mm Dacron graft and a 3/0 proline stitch.
No. 3/0 is far too heavy for a graft this size.
I thought the 3/0 was appropriate.
No. All right, that's it. You're out.
That's enough, Dr. Jaffrey.
It's my heart, and I'll tell you when it's enough. Rhodes. You're in. Take the instruments. Now.
Dr. Latham, I believe that it's time to put our esteemed patient under general anesthesia.
What? No.
I think it's in his best interest.
Look, wait a minute. We had an agreement. Come on.
Alan, if you would please.
No. Alan, you do not. You wouldn't dare. What?
Oh. How about that? So quiet you can hear a heartbeat. Now, Dr. Becker, I believe you were about to sew in the graft with a 3/0 stitch.
Suture and debakis. We were able to completely remove the tumor and reconstruct the superior vena cava.
Dr. Jaffrey.
You disappoint me.
Dr. Jaffrey, everything went perfectly. All according to Dr. Becker's plan. You were right to put your trust in her. She is a first-rate surgeon.
Get some rest, Dr. Jaffrey. I'll be back to check on you soon. Connor. I have to go put in my surgical notes.
Hamilton offered me a job.
You gonna take it?
I haven't decided.
You already have the most prestigious fellowship.
It's a partnership. 3 times the money, car allowance, moving expense, pension plan, the chance to work for a guy who gives a crap what other people think.
So why didn't you just tell him yes?
I made a commitment here.
Right.
House would let you out of it in a heartbeat.
Or he wouldn't, just to jerk me around. Would you guys have taken the job?
Don't need the money.
I'm not like you. I don't hate House.
You guys really don't have a problem with him, with what he did?
He knows we disagree with his choice.
Choice? Chase, it's not apples and oranges. It's right and wrong. And he does it like he doesn't care. He assaults the guy and moves on to the next differential diagnosis like it's
What do you
nothing.
want from him? More hand-wringing, more torment? You want him to cry himself to sleep at night?
Yeah. Yeah, I want some clue that he knows it's a big deal, that it scares him, that it matters.
Whoa. What was that?
It was a stroke.
Well done, Cameron.
House called it. The arm and legs are unrelated.
You make enough calls, one of them is bound to be right.
Yeah. He's just a lucky, lucky guy.
Listen. I just think it wouldn't hurt him to learn a little humility.
So what's the verdict?
Embolus. The arm problem was caused by a clot.
There's a good chance we can still bust the clot with TPA.
Do it. See what happens to his arm.
We found a blood clot in your brain. We'd like to start you on heparin. It's a blood thinner.
What are the side effects?
Well, your lungs are kind of chewed up from the pneumonia. Good chance there'll be an effusion.
Bleeding?
Into his lungs.
It's our best chance to give you back the use of your arm.
I don't need my arm without my air.
The damage would likely be minimal.
No.
It's his call.
Or we could do an embolectomy. Basically, we go in and pull the clot out.
He's saying no to drugs and you're recommending brain surgery?
Bypasses the risk to the lungs.
It'll either help your arm or
it'll kill me.
From your point of view, it's a win-win.
Okay.
We'll set up the procedure for today.
We're in your carotid artery. This is going to take us all the way up into your brain.
You all right?
Yes.
The sludge is blocking the blood flow to the part of the brain that controls your arm. Well done. You still okay?
Thermal softening happening weekly. Close on for the time being.
No monitor, no suction.
Oh, quartering.
But you still have me, right?
Oh, yeah. Hold him firm.
Can we get a battery-powered van?
Reynolds?
It's all good, Dr. Sharp. I'm holding his heart together with my fingers. But without power, we got no cardiopulmonary bypass.
No way to titrate anesthesia.
We can't operate without him.
Max is working on the generator.
How are you doing, sir?
Well, you know.
Can I get another micro-instrument kit? On it.
Shouldn't we be evacuating?
No.
To where? How? In this storm, we can't even get across the street.
Yeah, it's true. She's right. We're one of the only hospitals with the, I was gonna say with the lights still on, but,
We could move everybody to the same floor.
Yes.
That's crazy.
Well, why? We're not at capacity. Look, it's Helen's idea.
But that's only because you won't let me triage.
No triage. Look, Henry is having difficulty seeing. Would you grab a flashlight and meet us down there?
Yeah, yes.
Max, we cannot.
We will.
His blood pressure's dropped. Down to 90/64.
Hang in there, Hugh.
Is that a fence joke?
Just keep talking. Make a list of all the things you're gonna do with your husband when you get home.
What's his core test?
Scrub the baseboards, fold the towels. Though Eric always says 3 folds is overkill.
Eric can have an opinion on 3 folds when he starts doing laundry.
Good point. You have to help me remember to tell him all this if I make it.
You're gonna make it.
BP's dropped 82/40.
We need to do something now.
Hypothermic coma. Lowers body temperature near freezing and slows metabolism.
Wasn't I freezing outside?
Oh, no. This will be controlled. I'm afraid it's our only option.
Respectfully disagree.
You bring me some power?
No, but we can do his surgery right now.
What?
We have all the equipment we need here. I worked in far worse conditions in Afghanistan.
Dr. Candelario, this is my patient, my OR.
Your OR has decent lighting and electricity. We can save this man. But I'm gonna need you to let go. Literally.
Go ahead with the IV, it'll help keep these.
Right ventricle's exposed.
Lung sounds bilateral.
In a traditional surgery, this is where I'd stop the heart from beating.
But we can't do that.
No, we can't.
37 degrees.
But you've been holding the heart for a long time. Perhaps you've got the rhythm down, right?
You want me to time each suture to the relaxation phase?
Exactly.
All right, keep me updated.
Time to let go.
Can you slow him down a bit more, Alicia? Give me time to sew.
I'll try.
Kat, I'm gonna need a 3-0 Proline on a needle driver.
You're doing great.
It's not much different, actually. I mean, it is, but I never realized how much I relied on machines. Doing it old school like this makes me think I might be a better surgeon than I thought. Oh, no.
Alicia?
What are you...
Alicia!
Alicia, get him back up here! His heart's racing.
I'm trying.
We need blood. Oh, Ned.
There isn't any. We exhausted the supply earlier tonight.
Then find some. We're not losing him.
The city's still out.
That means a generator.
We've got power. Hook him up.
Says the ABCs.
Continue monitoring manually until all.
Come on, man. You just have to hang on a bit longer.